A key part of our integrated care strategy in Sussex is going to be to develop integrated community teams. And that means we want to wrap around our health and care services around each local community. Now, some of those local communities are clearly going to be local geographies. So here I am in Crawley today, and Crawley is a town of about 100,000 people, just over, and 25% of that population is under the age of 19. Another 25% of that population is also from an Asian and a minority ethnic background. So therefore the health needs of this particular population are different to maybe what is required in Horsham or Chichester, Hastings or even Eastbourne. So on that basis we want to build these teams around the health and care needs of that local population. And that's really what the integrated community teams are all about. At the moment, our health and care services are delivered by a whole range of organisations. There's different parts of the NHS, there's our local authorities, there are borough and district councils, there's voluntary organisations, community organisations, all of which are trying to do their very best to serve the populations, but sometimes that care is not as joined up as it needs to be. And so what we want to do is to actually join up the care so that actually it's a one-stop shop to really genuinely help the population to improve their health and also their care. There are a number of examples where our teams are already working together across health and care in individual local communities. I'm here today in Crawley, and there's a big programme ongoing at the moment called the Crawley Programme, which brings together the NHS, the local borough council and other voluntary and community organisations that are all working together to find ways of improving the health of this particular population. And they've set up all sorts of additional forms of cancer screening, for example, working with the GP surgeries, thinking about how these services can be offered at different times of the day. So I think there's a number of examples in that particular programme. Another example is over in Hastings. We've got the Universal Healthcare Programme, where again we're working with the Hastings Borough Council and also East Sussex County Council from a public health point of view, and we're thinking about working with the local communities to develop a new programme that can actually develop some of the new health services that will address some of the inequalities that exist in that particular population. So they're just two examples, but there are many more, and I think with the integrated community teams we've got a real chance to make a real difference to the population of Sussex. Well, the integrated care strategy is a 5-year plan, and we're going to need all of those 5 years to actually make this vision become a reality. I think we need to take the first step, and this year is about putting the foundations in place. It's defining the communities that we want to serve. Now, some of those are clearly going to be around geographies, but it can also be around communities where people have got very similar interests or very similar health needs. And I think actually that needs some time to think that one through. So that will in fact take most of the first year. Then we need to think about what are the partnership agreements we need to put in place in years 2 and years 3. And so it'll probably take until years 4 and 5 until these really integrated community teams become a real reality and patients can see the difference of all the organisations working together to deliver better health and care and improving lives together.